Don't run off with those. Do you find yourself asking, is it hot in here? A lot? Hot flashes, night sweats, insomnia, weight gain. Those are all signs of hormonal imbalances. Finding relief from those symptoms can be confusing, and Terry Suresh, nurse practitioner and founder of Hormonal Health and Wellness Centers, is here to take the confusion out of all the different types of hormone replacement therapy, something that affects a lot of people. And before we differentiate between the different types of HRT, let's go back and quickly, if you would remind us of the symptoms. So if you're sitting out there going, I don't know if this is wrong with me or not, or where I am in all this. What are the symptoms, first of all, for women?
Right. For women, it really starts in our 30s often with just vague symptoms like fatigue and depression, anxiety, irritability, mood swings. It's hard to focus. Hitting a wall in the afternoon, 2 to 4 o'clock in the afternoon's hallmark. Staying asleep at night, a huge one. Falling asleep, not the issue. Staying asleep is the issue. And, of course, low libido for women. That's a classic symptom. And then the hot flashes kick in and the misery goes up, you know, a couple of notches.
And what about men? How are the symptoms different?
Men have, it's a little more vague. They start their decline in their mid-30s, definitely by the time they're 40s. The brain fog, a lot of the guys say my brain and my mouth aren't connecting. It's on the tip of my tongue, so it's a lot of brain symptoms. Fatigue, that get up and go, got up and went, you know, the honey-do list, they couldn't really care less about it. The things they once enjoyed, they don't really care about anymore, like golf or sports. They kind of just want to sit around on the couch and, you know, with the remote, is what most of the guys report.
And that's not just being a guy.
That's not just being a guy.
Okay, so there are shots, creams, patches, pills, pellets. What's the difference between all of those, other than the obvious?
Other than the obvious, you know, some of them are bioidentical, some of them are synthetic, but the biggest difference is the roller coaster effect, especially with shots. And the side effects that I've seen in my practice with shots, with liver function issues, high estrogen levels in guys, it's kind of a one-size-fits-all approach. And the other problem with shots and creams is you administer the medication and your hormones spike up for a few hours and then you crash, or for shots, they spike up for a few days and then guys crash and they get really cranky when they crash. It's not a good feeling. Pellets are actually my favorite, and they for a lot of reasons, bioidentical.
That's what I was going to ask you. So why? You like pellets, why?
Well, I've tried all of the other modalities in my practice, and pellet therapy makes the most sense. It answers all of the questions that I couldn't answer with the other modalities. They've been around the longest. They've been around since the 30s. A lot of people don't know that. They were around before oral synthetic hormones came on market. They're the easiest to balance people because the dosing is very specific to the patient. It's based on parameters of age, weight, blood levels, activity levels, and then your blood is retested after a time to make sure you're in balance. And then, of course, you only have to do it 2 to 3 times a year, which is better than a shot every week.
Okay, so, well, anything's better than a shot every
no
week.
Kidding.
So when you say pellets, how are they administered, and then how long does that last?
Oh, great question. So the way the pellets are administered, first we get blood work to determine what your need is, and then it's a quick procedure that takes about 30 seconds in our office. About a minute or two for guys. The area back on the hip is numbed and the pellets are placed under the skin, and it's closed with just a little butterfly bandage, and they last about 4 to 5 months in women and 5 to 6 months in men. So once your levels come up, you just stay there steady, and that's where all of the long-term benefits that we see from hormone balancing come from, is that 24/7 balance instead of the roller coaster that you see with other modalities.
So those are the obvious reasons why you prefer pellets to any other type of therapy.
They're dosed individually, they last a long time, and they've been around the longest. The most medical studies we have based on pellet therapy than the other therapies.
Okay, finally, before you get away, how do you find someone who is good in this area if you're looking for a practitioner?
Right, so you know, a lot of people have tried to figure it out, even pellets, and you really just want to make sure that the practitioner understands how to balance hormones. It's not just about putting 1 or 2 pellets in the body. You want to make sure they really can articulate how to balance all of the hormones, not just testosterone, not just estrogen, testosterone, progesterone, and all of the other supplements that go along with it.
Okay, well, it's important stuff, so obviously we want to be careful and appreciate the information.
Thanks.
Good stuff. Thank you very much. You can find out more by calling Hormonal Health, Wellness, and Aesthetic Centers in Dallas and Southlake. The numbers are 817-328-8376. In Rockwall, 469-402-1877. If you mention GMT, you get 50% off your consultation fee. You can also log on to hormonalhealthandwellness.com.